I'm Dr. Diana Domenko. I'm a functional medicine practitioner, and today I will walk you through what an elimination diet is, who will benefit from it, essentially what kind of patients with what kind of medical concerns, how long to do the diet for so that it has therapeutic benefits, and also what is the take-home message from an elimination diet. Let's explore this topic deeper. And at the end of this video, you'll be provided with actionable steps that you can take to be successful at the elimination diet. So what is an elimination diet? The elimination diet excludes the foods that you can see on the screen. Gluten, dairy, corn, and soy are typically the foods that people are the most sensitive to. The idea is to remove these foods for long enough to see if any clinical change occurs, essentially if a person feels better while they're not eating the foods that are commonly causing symptoms. After that period of time is done, you reintroduce foods one by one to see if the symptoms you've previously had come back. Essentially, that would tell you if you're sensitive to these foods, and that would allow you to know to eliminate them further on. Simply put, it is a diet that decreases our inflammatory burden coming from food. If you're eating food day in and day out, and the food that you're eating is causing you inflammation or is contributing or worsening your symptoms, wouldn't it be great to isolate the foods responsible? In my clinical experience, I found that people who are suffering from frequent and annoying symptoms, whether they have a disease or not, are suffering from food sensitivities and benefit from an elimination diet. So first, let's see who should consider this diet. Again, this diet usually lowers your inflammation, and inflammation is a necessary ingredient for all chronic illnesses. People with digestive symptoms can benefit. IBS, bloating, reflux, inflammatory bowel disease, or any kind of gas or belching. People with skin issues such as eczema, acne, urticarial rash, psoriasis, and even hair loss. Any kind of neurological symptoms should be considered as well. Brain fog, fatigue, memory issues, neurodegenerative problems such as MS, forgetfulness, chronic pain symptoms. This is a very common symptom, and food sensitivity should always be considered in this case. Urinary problems such as someone having repetitive UTIs or having to pee frequently, having any leakage or incontinence symptoms. Sluggish immune system would benefit. People who have chronic infections such as chronic sinusitis or bronchitis, for example, or vaginitis. Surprisingly, even behavioral problems can be influenced by food. So someone who has anxiety or depression or gets angry or flustered very easily, even ADHD patient can benefit. Respiratory symptoms such as asthma. Palpitations, assuming that this was previously investigated and found to be benign. Any symptom that your doctor attributes to old age or tells you that there's nothing worth investigating, but you know in your gut that this is not normal. So almost anyone can benefit from the elimination diet. Now, this diet has to be followed for a minimum of 4 weeks. The reason for that is because the body produces IgGs or antibodies to food, and those antibodies take some time to be cleared by the body, specifically about 30 days. Most antibodies have about 30 days half-life, which means that in 30 days, half of the antibodies produced against tomato, for example, will be cleared or eliminated from the body. That is why the 30 days or 4 weeks is the minimum amount of time for you to do the elimination diet so that you can see benefits. After that time, for example, if you don't consume tomatoes, no new antibodies to tomatoes will be produced, and therefore that will reduce the inflammation in the gut and the inflammation in the rest of the body associated with that sensitivity. So at the end of this process, once all the foods have been eliminated and new foods will be reintroduced sequentially one by one, you will have a much better idea which foods are causing you inflammation, triggering or contributing to your symptoms, and that will give you agency or control over your own body, your own health. You'll be able to eliminate those foods in the future if you so wish. So for example, if dairy and gluten were problem foods that you found out about, it is important that every 3 months you try to reintroduce them, because sometimes food sensitivities disappear with time. It is also important to note that if you don't react to any foods contained in the elimination diet, it doesn't necessarily mean that you don't react to foods. Perhaps just means that you don't react to foods from the elimination diet. Remember, there are numerous other foods that people can react to, and depending on your health condition, you might benefit from a different type of diet that will be more restrictive or more tailored to the specific health concern you have. For example, a thyroid condition like Hashimoto's thyroiditis will benefit from a paleo autoimmune protocol, versus an interstitial cystitis condition will benefit from a low histamine diet. Step number 1, clean your cupboards and your fridge of all the foods you're not going to be allowed to eat for the next 3 weeks, or up to 6 weeks if you desire to take an elimination diet to a longer duration course. This way, you will not be tempted to indulge in the foods that you are not allowed to indulge in. Step number 2, pick a date. This is an important one because after that date, you will be committing 100% of your time and devotion to following the elimination diet and not steering off course. I suggest to pick a date that is not around a holiday time or around a special time where you and your family will be going to follow a vacation or going on a trip. The reasons for that is that the elimination diet requires a lot of change and a lot of planning, and you may be tempted to eat differently if everyone else around you eats differently and if it's a special time of the year. Step number 3, go to the grocery store and pick all the foods that you are allowed to eat during your elimination diet. I suggest to plan and think ahead. Essentially, what will the next week look like for you while on the elimination diet? What kind of recipes will you be following? So below this video, you'll find a list of foods that are allowed in the elimination diet that you may take with you as a guide when you go grocery shopping and decide to select some of the foods from that list when you plan your week ahead. Step number 4. This is an optional step, however, it is highly recommended. This is where you pick a buddy or a friend to do the diet with you. The reasons for that is that it makes it far easier to comply to a strict regimen when someone else is doing with you, because you can help each other and encourage each other, or you can commiserate when times are difficult. 5th step. This is a step where you actually engage in doing the elimination diet. So this is a critical period of time where you want to be 100% compliant with the diet. You don't want to cheat, not even 1% of the time, because as we've established in a different video on food sensitivities, when a person's immune system is triggered by certain foods, antibodies are being produced. So essentially, even if you are exposing your body and your immune system to the foods that you are sensitive to, only 1% of the time, that is enough to stimulate an immune response and to have an ongoing production of antibodies against that food. Therefore, it will be important to stay 100% clear of the foods that you are eliminating to make this diet worthwhile and to have valid responses. Final step is a reintroduction process. So let's say you've done the elimination diet for 3 weeks, or it was 4 weeks, and now you're ready to challenge the foods that you removed from the diet. How do you do that? So step number 1, essentially you'll add the food that you miss the most. Let's say it's eggs. So on day 1 of the reintroduction phase, you will add eggs. And on day 2 and 3 of the reintroduction phase, you will add nothing at all. You'll stay on the elimination diet. But at the same time, you will monitor your symptoms, making sure that no new symptoms arise, such as things like headache or fatigue or feeling bloated or having joint pains or rashes. Any new symptoms, it's important to be astute and to pay attention. Let's say, for example, you react to eggs and you develop joint pain, like knee pain, for example. This was something you had before doing the elimination diet, and now that you are reintroducing eggs, you notice that the joint pain is coming back and you didn't really have it during the elimination diet. So eggs are suspicious. They might be the reason, or they might have triggered the return of the knee pain. Therefore, they are out. They are not safe to reintroduce, and we will put them aside. Essentially, the next day and the day after, you just wait until your knee pain goes away, and once that's restored, you're free and ready to add another food to your diet. Let's say you add coffee. And again, you will engage liberally in drinking how much coffee you want on that day of the reintroduction of coffee. And again, 2 days that follow that, let's say day 1 is reintroduction of coffee, then day 2 and 3, you will not reintroduce coffee. You will just stick on the elimination diet and pay attention to your symptoms. This is when journaling is super important. If no symptoms occur, then you consider that coffee is fine and safe to reintroduce, and you reintroduce coffee. So you will essentially go through this process systematically, one item after the other, and you will decide what goes in and what is staying out of the diet. This process might take 2 to 3 weeks or longer, depending on how many symptoms you have and how many of these symptoms are triggered by the reintroduction of foods. So I have some important tips that might help you be successful when you reintroduce foods and to be able to really utilize this elimination diet to have valid information from that. So step number 1, or tip number 1 rather, you would want to reintroduce foods that are essentially mono ingredients or single ingredients. Let's say you take the example of coffee. You love coffee and you just can't wait to drink that coffee. So I suggest taking a black coffee or coffee with dairy substitute, like let's say almond milk or rice milk that you're already using and you know that you don't react to. So either black coffee or coffee with almond milk, for example, will be the coffee that reintroduce, but don't introduce coffee and milk dairy at the same time, because if you react, it's going to be hard to know, is it the coffee, is it the milk dairy that caused the reaction? So that's going to help you be more successful. Another example of that would be essentially reintroduction of soy products. Instead of using, for example, soy sauce, that has soy and gluten, which are two triggers of immune reactivity, just choose edamame. It's just soybeans that you cook, you boil them, you add salt, and you just ingest those. This is a much better way to introduce soy products. Tip number 2, make sure you don't go hungry while on this diet. So one thing that could happen is in a patient, for example, or a person that eats a lot of high sugary foods, that person may go through some sort of a withdrawal period when removing the high sugary foods. The withdrawal from sugar looks like symptoms of relative hypoglycemia, such as being irritable, having cravings, having trouble concentrating, perhaps even having slight tremors or even sweats. So if you're not diabetic and if you're not on medications that lower your blood sugar, this is not dangerous. It's not an actual hypoglycemia. It's just triggered by the relative difference in the amount of sugar that you're eating from one meal to another. And the best way to improve the symptoms of this relative hypoglycemia is to make sure you have snacks. Something like hummus and carrots, for example, would be pretty good, or snacking on nuts like almonds, or you can snack on coconut yogurt with some hemp seeds on it, or just a simple fruit like an apple. So that could help essentially. Make sure the foods that you snack on have fiber or have protein, have fat, have a few different things to keep you full. Tip number 3, plan ahead and prepare some raw ingredients for you to utilize later on when you make your dishes and your meals. For example, you can cook lentils ahead of time, or chickpeas, or you can prepare sweet carrots or sweet potatoes rather, that you would pre-boil ahead of time. You can do the same with salmon. You can either boil it or oven bake it and add that salmon to your dishes, whether that's a stir fry or whether that's a salad. Have some vegetables that you pre-cut ahead of time, like celery and onion and carrots, that you can just add on the pan and saute them together with some spices, and that will add some flavorful meals that are easy and quick to put together. I'd also suggest to stock up on seeds and nuts. That is something very simple. You can add them without cooking or processing in any way. You can add them to salads or soups, or they can be a snack on their own. They are rich in fiber and they contain healthy omega-3s as well as frequently protein, especially in the case of nuts. This is all I have for today. Thank you for listening. If you have done the elimination diet, please let me know how it went in the comments below. If you have any questions, feel free to add them as well. Thank you and have a nice day.